Hi, I am Dr. J.P. Silvera from TaylorMade Health and Wellness, and I want to tell you about a patient who walked away from a rear end collision feeling completely fine, and 4 days later couldn't turn her head far enough to back out of her driveway. She had told her family she was okay. She went back to work the next morning. There was no drama at the scene, no ambulance, no dramatic moment, just a car accident, a quick check, and she moved on with her week until she couldn't. This is one of the most common patterns I see after auto accidents, and it is also one of the most misunderstood. So if you or someone you love has been in a collision recently and you are wondering why you feel worse now than you did that same day, this video is going to explain exactly what is happening in your body, what the standard medical system almost always misses, and what you can actually do about it starting right now. Let's talk about the adrenaline problem first, because this is where almost everyone gets confused. When your car gets hit, your nervous system does something remarkable. It floods your body with adrenaline and cortisol within seconds. Your heart rate spikes, your muscles tighten, your brain sharpens. It is your body's emergency response, and it is genuinely impressive. But it comes with a cost that most people don't find out about until 2 or 3 days later. Adrenaline masks pain, not forever. Just long enough for you to feel okay, tell your family you are fine, decline the ambulance, drive yourself home, and go to sleep thinking it was nothing. Then the adrenaline wears off, and the inflammation that was quietly building in your soft tissues since the moment of impact, that inflammation has been doing its work the entire time. By day 2 or 3, the muscles surrounding your cervical spine have tightened in response to the injury. The ligaments that were overstretched in that sudden jolt are now swollen and irritated, and the joints in your neck that absorb the force of the collision are now compressed and restricted in ways you can actually feel every time you try to move. This is called a whiplash injury, and the reason it is so commonly dismissed is that it often does not show up on a standard X-ray or CT scan. Here is something the emergency room does not always have time to explain to you. Imaging rules out fractures and structural damage to bone. That is critically important. And if you went to the ER after your accident and got a clean scan, that is genuinely good news. But a clean scan does not mean nothing happened. It means your bones are intact. Your soft tissue, your muscles, your tendons, your ligaments, the discs between your vertebrae, none of that shows up clearly on a standard X-ray. So walking out of the ER with a clean scan and then waking up 3 days later, barely able to rotate your neck, is not a contradiction. It is a predictable, well documented, completely familiar pattern. It does not mean something went wrong at the ER. It means the injury that was always there is now making itself known. What actually happens at the tissue level is this: the sudden deceleration of a rear end impact forces your cervical spine, your neck, to move faster than your muscles can brace against. The muscles and ligaments stretch beyond their normal range of motion in a fraction of a second. Micro tears form. The surrounding tissues respond with inflammation. As the inflammation builds, the muscles go into a protective spasm, which is your body's way of trying to immobilize the area so it can heal. That spasm is what you feel as stiffness. And that stiffness, left unaddressed, can become chronic pain, chronic headaches, radiating symptoms down into your arms, and postural changes that affect how you move for months or years afterward. The research on untreated whiplash is worth taking seriously. Studies consistently show that a significant percentage of people who dismiss early whiplash symptoms and do not seek treatment go on to develop long-term chronic neck pain, not because the original injury was catastrophic, but because the soft tissue dysfunction was never properly identified and addressed during the window when early treatment makes the biggest difference. That window matters, and most people do not even know there is a window. At TaylorMade Health and Wellness, what we do before anything else is a thorough, hands-on evaluation. No assumptions, no predetermined visit count. We want to know exactly what is actually happening with your spine, your joints, your soft tissue. We assess your range of motion, your muscle tension patterns, the alignment of your cervical spine, and where the restriction is coming from.